Adolescent Counseling Basics to Advance. Under the direction of respected Dr. M.K.C. Nair sir and leadership of Dr. Hima Bindu ma'am, Chairperson AHA. As we all understand, adolescent age group is the transition phase of development from childhood to adulthood. And this is the phase characterized by the phase of various emotional and behavioral changes, phase of experimentation and exploration, and every teen may present differently, behave differently to a particular situation. Hence, it is stress, anxiety, depression, rebellious behavior, these are all the common during this phase. So our today's speakers are going to share their thoughts on this particular topic, how to deal with a difficult teen in our OPDs. And to take this topic today, we have eminent faculties with us, respected Dr. Pukhraj Pafna sir, Dr. Nishikant Kotwal sir, Dr. Shamik Ghosh sir, and Dr. Deepa Janardhanan ma'am. I welcome you all on this platform. To grace this occasion, today we have our guest of honor with us, Dr. Neelam Mohan ma'am, President-elect IAP, Dr. Yokesh Parekh sir, Honorable Secretary IAP, and Padam Shri Dr. A.T. Dapke sir, past Dean JNMC Medical College, Raipur. I welcome you all on this platform. I request Dr. Hima Bindu ma'am to please say a few words about this program.
Thank you, Dr. Kavita. On behalf of Central AHA, Adolescent Health Academy, which is one of the sub-chapters of the Indian Academy of Pediatrics, I welcome all the dignitaries on the dais here. Our President-elect of Central IIP, Dr. Neelam Mohanji, and of course our MKC Nair sir, who's been a mentor for all of us. He is the program director for this very special program of the Silver Jubilee Year of AHA. And under his direction and guidance, we have been conducting number of programs, but this is very close to his heart and also in our action plan of this year. As this is a 25-year celebration of AHA, we have started a lot of innovative programs, and one such program is on high demand was the adolescent counseling, some training on. So we thought of doing a program on 6 to 7 topics of day-to-day importance where adolescents can be counseled. And while counseling the adolescent, we require a knowledge, attitude, and little skill for the pediatricians. So for which we are doing capacity building of our pediatricians, and we have taken registrations to nearly 200 registrations that have been taken within a short span. Once it was open, we had 200 people who have joined this course, or it is a program, and we are very happy about this very good response. And Dr. Kavita and Dr. Prashant Karia, who are the coordinators for this program, will make it very interesting by documenting all this. I know people, we have a pre-test, post-test, and we are doing it in a very structured way. And we have number of experts who are going to present the case scenarios, and they will discuss with another experts who are very senior in this field, and we'll be having a very interesting session. The first session went on very well, and this is our second session, and I look forward for a very successful session too this year, this session. And apart from this, AHA is also doing number of other interventions or innovations, like doing zonal adolescents, having adolescent boy module coming up, and we also have Yuva clinics. We are making an effort to start adolescent clinics in medical colleges and focus on adolescent vaccination. And a Wave 18, which is for the youth, by the youth, it is being celebrated on the 18th of every month. This has caught the attention of UNICEF, and we are having a long-term collaboration with UNICEF on this front. So with these few words, I request our chairperson of the president-elect of Indian Academy of Pediatrics, our dear Dr. Neelam Mohanji, to give a few words and blessings for this program of AHA. Over to you, Neelam. So happy that you are joined in spite of your busy schedule. I look forward for your support for AHA in all its efforts. Thank you.
Thank you so much, Hima and Kamita, for the kind introduction. Respected MKC Nayaji, I love the way he always sits like this. His photograph should always be typically, and that's his favorite pose, which I have. Respected Bafna ji, Swati in amnesia, she's not here, but yes, she's the advisor along with Madhushri Pandey. And all the stalwarts of adolescent. I remember I'll start with it. But Hema, I would want to start with congratulating you for this tremendous work you're taking. Our seniors, whether it was MKC Nair or Bhavna and, Tuteja ji, and the others who started thinking about adolescent more than a couple of decades back, and the ladies now have taken it, whether it was Geeta Patil who started with this, and thanks for rolling that ball, Geeta. And after that, I mean, Hima is doing such stupendous work, and Kavita is doing amazing, and I can go on with so many names here, because every time I see, whether it's Ritu who keeps connecting me, Deepa connects me, Latika connects me, and all, this started probably, if I retrospectively think, in late 90s when I did my training in pediatrics, and my senior residency also from AIMS. And at that time, I decided that I wanted to do a super specialty. And India, the only specialty which had come then was neonatology. And there was nothing beyond neonatology that we could think in. So I had the great option that whether I wanted to go into gastroenterology, or I wanted to go into genetics, or wanted to go into gastroenterology. I chose gastroenterology because transplants were something I dreamt of getting into India, and with that vision. But I remember vividly there was no one who would talk about adolescent in that time in India. But the way India marched, we went in a reverse direction. We started with neonatology and then went in to the other branches. And I think it was 2010. At that time in the decade, the specialties merged a lot. Like, I was doing a lot of work in gastroenterology, hepatology, nephrology, neurology, all this started merging. And that was the time that adolescent group started with their work. And to see, I think adolescent group is probably in its adolescent age. And because they are in the adolescent age in India, they are like absolutely bubbling with the energy, which is beyond the other. And I can see so many other faces, whether it is Prashant, Umesh Kurana, always smiling, and of course, Nishikant is someone who's done a lot of work in Maharashtra. Shamik Ghosh is wondering how to get himself sorted with all this number of ladies across him. But thank you from the bottom of my heart for doing so much of work. And I think what binds us together is that it's not just clinical work. Just like people say, dil to bacha hai. I think pediatricians need to say, this is one field we are so compassionate about, driving the message across to parents and bringing about a change in social. So, all of you, when you're on the platform, I think personally that more than your personal building up your careers, you're looking at how you're giving back to the community. And there is a very thin margin between what you perceive and what others look at. You might decide to do something passionately. And I've seen people, stalwarts, talking about, you start from your village and then you go up to your state, and then you start dreaming about bringing changes in the country. And as you grow, you actually think that the world is a village in itself, and you need to contribute to the world. And today, I want to also take this privilege to say that we are proud nationals. We are so proud. India is doing amazing, and we've reached as the fourth state. But at the same time, if any one of you, including me, wants to do something which is in global health, it should never be underestimated, as we are not interested in looking for the care of our children. Sometimes when you talk about global health, you may get uh, mistaken. So I want to say to all of you that there may be some who may think that you're doing it for publicity or you're doing it for any political reason. Go on with your work. As MKC Nair once said, I mean, I listened to a lot of his words. Like, if you know your conscience is right and what you think you're doing is right, go on. People will misunderstand you, raise fingers at you, but at the end, you should know that you should walk with your head straight. What you did was with a good intention. What you're doing is not for self acclaim. You work beyond your hours to do this and to talk about mental health. While you're doing all this, I urge you all, some of you, to start thinking of mental health for doctors too. I urge you all to think beyond this. People, while we are looking at the children, lot of our colleagues are going through a lot of mental issues, these competitions, jealousy, enviousness, and we need to take some sort of sessions for us to make us closer to wisdom, to Almighty, and to what seniors have taught us beyond self. With those few words, I wish this program a great success, because mental health, whether it is children, whether it is adolescent, whether it is adults, it is such a big issue today. And when I talk to colleagues, I get confused that where are we marching to? We need to embrace everyone, men, women, young, old, and remind ourselves what we give 9 times comes back to us. Let's give good, and I'm sure goodness will come back to us. I wish all of you all a stupendous day, and I really, my dream, I'm working a lot right now in nutrition, and I want to work a lot in that field. The second field which I take is the adolescent and mental health. So thank you for having me. And
Thank you
today,
so much.
on the complementary feeding day, 6th and
Yes.
6th, while we talk about the right feeding, I will just end up by saying, if you want to have a physically, mentally, and emotionally right person, you wouldn't have been talking about these issues if you were right in your nurturing in those. So the foundation comes with nutrition, parenting, and this. And because we defaulted there, it is time we pediatricians have taken it to ourselves and are talking about the mental health. Thank you and wish you more power to come.
Thank you so much, Dr. Neelam. Thank you.
And respected Yogesh ji, I didn't see your face. Respected
Yogesh Parekh sir has
works,
joined.
yes, he's
Yeah,
joined
we welcome
and
the
he works
secretary.
like a rock throughout. Thank you for all the good work you're doing for IAP.
Thank you,
Bless
Thank
you.
madam.
you.
Thank you.
Yeah,
Thank
over
you.
to you, Dr. Yogesh Parekh ji. Special welcome. You are the guest of honor today for along with Dr. Neelam. We invite you for your blessings on this very special second session on adolescent counseling program of AHA.
So thank you, Dr. Neelam Mohan madam, for your kind word, and Dr. Hema Bindu madam, Dr. Sushma madam, and whole team of the AHA, Dr. Geeta Patil madam, Dr. Nishikant sir, and we are blessed 3 days back with the Dr. MKC Nair sir, and we have a visit to sir's home at midnight in nearly 11 o'clock. And sir was there, and sir
Bad
blessed
habit,
us.
he doesn't sleep right on time.
Yeah, okay, okay. So, sir, it is heavy raining, even though sir came with the chata on the road, and miss brought all of us to the sir at home, and offered the tea and coffee at the 11 o'clock. So, thank you, sir, very much, sir. And always we admire your whatever you say. Dr. Neelam Mohan, madam, quoted this, be on time, punctual, discipline, honesty, everything what you have given given the 2 or 3 example your personal life. And thank you, sir, for your motivation. And always Dr. Pukhraj Bapna sir is here to guide us, and whole team of AHA. So I congratulate and the best wishes for this AHA workshop. We all are committed for the whatever the good work AHA and IIP do together. So we are always supportive, and Geeta Patil madam have done excellent work last year, this year Hema Bindu madam, and next year Sushma madam will do best. Honorary Secretary Prakash Virarya sir and Dr. Shamik, Dr. Sneha, all are doing excellent work with the Dr. Kavita and Dr. Prashant Karya. Always Prakash Vir sir and Dr. Ritu, Dr. Kavita are inviting me and giving the personal call. So and Dr. Hema Bindu madam also called today. So this is all about the passion. Whatever the you people are doing with the for this mental health of the our adolescent. So I think this is a extraordinary work, and mental health is not only standalone concern, but it is only all this deeply intervened by the all physical health, nutrition, digital wellness, screen time, social support system, and everything you people are discussing to explore the practical intervention. So I again congratulate the AHA. We are here to support the whatever the commitment for the adolescent health. So let us use this digital platform to exchange our ideas and share the best practices, whatever the level we are doing, and strengthen our collective efforts. So thank you very much for the inviting and giving this honor. Thank you. Best wishes.
Over to you, Kavita. Thank you so much.
Sushma, I want to say you have a lot of task in hand.
For
With
next
Geeta and
year.
Hima doing this, Sushma needs to get up, and I'm all there for you.
Thank you,
Yeah.
sir.
Thank you.
So,
Thank you so much for both these central IP.
Madam engaging from this platform, Sushma Madam and Prashant, Kavita will take lead next year.
Yes, and all the stalwarts, I could not take name. Apologies. You know, could not take. But yes, joy. You always give joy. Always are persisting there. I
Yeah,
always
yeah,
see you see
joy is there.
progress. Thank you.
Thank
And
you.
Okay sir is always supporting all the endeavor.
Thank you. The Central IIP leadership is here to bless all of us. And thank you for your blessings, Dr. Neelam and Dr. Yogesh ji. I request Dr. Kavita to please proceed with the session. Thank you.
Thank you, ma'am. Thank you, Neela, ma'am. Thank you, Yogesh, sir.
Bless you,
Your
Kavita.
words, yeah, thank you, ma'am. Your words and support means a lot to us. So in future also, HA would expect all the support from you.
Yes, but
I think
I will be there. But as I said, you need to work on mental health of adults. Geeta will be
definitely,
given that
Yes.
responsibility
yes,
Yeah.
because everybody calls her that. She's senior to me, and I love and respect her a lot. I'm very meticulous. You have to take the mental health of doctors seriously next year, where we need to get beyond ourselves.
Thank you, ma'am. Thank you. Our next guest of honor, Dr. Dapke, sir. I'm not able to see him. I think he's not there. Dr. Dapke, sir, he's not there. So
Not
we can,
here. Yeah.
yeah,
Next.
we can proceed. So let us now move on to the academics today. Coming to the introduction of our speakers, बाफना सर को इंट्रोड्यूस करना मतलब सूरज को दिया दिखाने के बराबर है, but I'll try my best. Sir is from Rajnandgaon, HOD Medicine, CDC RI. Till now, he has interacted with more than 5 lakh teenagers. He's author of chapters in many books. He's achiever of 3 world records. Weekly health column since 53 years uninterrupted. The only book on status of tribal child health and research on yoga and adolescent asthma. He has received many awards like Padam Shri 2011, National IMA CT Thakkar Award 1979, Dr. B.C. Roy National Award by MCI, Lifetime Achievement Award of Award Times of India, Lifetime Achievement International Award, Lifetime Achievement Award Udyanchal, Academic Excellence Award IAP. सर बहुत सारे awards हैं आपके तो. Several oration awards: World Congress Oration Nagpur, Dr. Swati Bhave and MKC Nair Oration Award 2016, Dr. D.S. Dave Oration Award, Dr. D.V. Shirol Oration Award. Sir is Chairman of Ethics Committee, Government Medical College Rajnandgaon, CG Dental College Rajnandgaon, Government Digvijay DG College Rajnandgaon, and Shayad Hospital Research Center, Delhi Rajhara. Thank you, sir. Thank you for being here to enlighten us with your knowledge and experience. Our next speaker is Dr. Nishikant Kotwal, sir. He's adolescent health specialist from Nagpur, chairperson of Maharashtra AHA, ex-West Zone member AHA, past president IAP Nagpur. He's consultant pediatric and neonatologist at Manorama Children's Hospital since 44 years and Colors Mother and Child Care Hospital since 14 years. Conducted many nursing workshops, adolescent workshops, workshops for teachers and parents. He has contributed a chapter in the textbook of Adolescent Medicine 2024 on street adolescence. He is national coordinator for web-based learning module for teachers. Published a case paper in Indian Journal of Child Health in 2019 and a research article in Journal of Pediatrics and Neonatal Care. I welcome you, sir, for your deliberation on this platform. And for the next two series, I request Dr. Prashant Karya, sir, to please take over.
Thank you so much. It's my honor to introduce two experts. Both of the experts are ever smiling and a very good friend of mine. Dr. Deepa Janardhan, a pediatrician from Kerala. She is at present the chairperson AHA Kerala 2025, and she was the South Zone coordinator for the AHA, Central AHA for year 2024. She is not just a pediatrician, but an adolescent health expert with academic interest. From coordinating national workshops to many educational modules like a perfect lifestyle make stronger lifeline, which is actually a wonderful module for the pediatricians, parents, and teenagers. And that is one of the most important contribution of her. She has also authored chapters in the IAP-AHA textbook of adolescent medicine, and she also helped to publish the national guideline on preconception care along with Dr. MKC sir and Dr. Hima Bindu ma'am. I was also one of the contributors in that. And with her leadership, IAP, AHA Kerala actually got two back-to-back Best State Chapter Awards from Central AHA. Kudos for her. So by this, she doesn't just speak on adolescent health, but she also builds the platform, the policies, and the peoples who carry it forward. So we welcome Dr. Deepa Janardhan. Our next expert is Dr. Samik Ghosh. He was EB member with me in AHA. He is a senior consultant pediatrician from Kolkata, done MBBS and DCH from AFAMC Pune, done DNB Pediatrics, MRCP from the Edinburgh, FRCPCH from the London, and last year he was awarded FIAP from the Central IAP. Dr. Samik is actually having a global insights and he works with full dedication, whether it is with the stethoscope in his clinic or with a mic in the national conference. He always takes away the charm and he's expert in the complex topics. He is going to be a today's expert. So together, these two powerhouses of AHA are going to be the experts, and we welcome both of them. Thank you so much.
Thank you, sir. Our today's program is going to be some different kind of, and hope audience are going to enjoy it. So I hand over to Dr. Pukhraj Bafna, sir, to start the program.
Good afternoon, friends. The most vibrant president of AHA, Dr. Hima Bindu Singh, celebrating Silver Jubilee year of AHA. The most respected, versatile, and bhandar of knowledge, our course director, Dr. MKC Nair, our guru. Guest of honor, Dr. Neelam Mohan, the incoming leader of IAP. Dr. Yogesh Parikh, our beloved and ever smiling secretary, and our Dr. Dabke is not here, and the office bearers, rest of the office bearers of this program. and very, very active, devoted, and dynamic coordinators, Dr. Kavita and Dr. Karya. Welcome to this second episode of Advanced Counseling under guidance of Dr. M.K.C. Nair, the creator of this seminal work, where we are going to elaborate on mental illness of adolescents. In this group, we have a very senior adolescent, Dr. Kotwal, very senior adolescent, Dr. Kotwal, and an expert who is an expert, and two very young adolescents, Dr. Shamik and Dr. Deepa. I welcome you all. Friends, getting into teenage is the entering into an uncharted zone. There is excitement as well as sense of insecurity. Adolescence is a whirlwind, एक बवंडर है हमारा जो ये पीरियड है किशोरावस्था का of change and roller coaster of emotions, a crossroads brimming with both potential and pitfalls. The transformation phase presents a unique set of changes often met with limited training and lingering uncertainty. Friends, adolescents constitute 21% of Indian population. This is also the phase of development where many mental issues they arise. Common adolescent health problems include mental health illnesses like anxiety, depression, behavior problems, conduct disorders, substance abuse, poor scholastic performance, etc., etc. Because of industrialization, because of urbanization and climate change and hormonal change in adolescents, these adolescents are facing more challenges these days. Risk factors which predispose adolescents to mental health issues can be many: individual factors, family factors, social and community factors. Why mental health is so important to adolescents? Let me tell you. When an adolescent experiences good mental health, they are likely to have positive perception. They have realistic and healthy views of themselves and are able to acknowledge their strength and weakness. Friends, our collective efforts to empower our pediatricians to become confident, effective educators, and skilled counselors, fostering holistic approach to adolescent well-being, because early intervention and early identification, they are crucial in management. So friends, let us be with our teenagers and make it their most memorable phase of life. Thank you very much for inviting me, and over to Dr. Kotwal. Thank you so much.
Yeah, who is going to share my slides, please? Dr. Shami?
Yes, I will.
So yeah. At the outset, I am really thankful to Dr. M.K.C. Nair. In spite of illness, he joined this program. And I'm extremely happy that he is here so that I have a great learning experience. We have Dr. Neelam Mohan, Dr. Hima Bindu, who is the chairperson of the AHA, Dr. Yogesh Parekh, secretary of the IAP, and our ex-dynamic chairperson, Dr. Geeta Patil also. My colleagues, I won't say colleagues, my respected Dr. Bafana, my colleagues Deepa and Dr. Shamik. Can you hear me all, Shamikda?
Yes.
Okay. So basically, my topic would be anxiety and depression, an overview of this. Can I have the next slide, please? If you look very carefully into this photograph, you will find many of the symptoms which are present in anxiety. And I would like all the persons who are attending this symposia to please write it down, whatever they see in this particular picture. Basically, anxiety is a feeling of worry, nervousness, and fear that is persistent and overwhelming, and that is why you are not able to perform your day-to-day duties also. Or you perform, but you perform with something which is seen in this photograph. The next one. Next slide, please.
This one, sir.
Yes. DSM-5 has defined anxiety, has divided anxiety disorders into multiple anxiety disorders. Generalized anxiety disorder, that you feel anxious anytime, exam tension or anything which you are doing. I think Dr. M.K.C. Nair would agree with it that every person in his life, sometime or the other, either he becomes apprehensive or he has anxiety, but he doesn't suffer from anxiety disorder. There are obsessive compulsive disorders which are again categorized into anxiety, panic disorder, post-traumatic stress disorder, which is more common these days because of more types of traumas which are occurring on adolescents, and social anxiety disorder. This social anxiety disorder makes people introvert also. Next slide, please. Prevalence of anxiety in adolescent in India, I'm talking only of the adolescents, okay? So it is 23%, and the factors contributing are the physiological changes which are occurring in the body of an adolescent makes him more vulnerable for anxiety. Then the psychological changes, the social
Can I request the host to mute everyone, please, other than the speaker? Dr. Sneha, please mute yourself.
Okay, I'll continue. So there are socioeconomic factors also, because poverty also leads to anxiety. If the person has, imagine a person who is poor, he is getting good grades, can get admission into medical college also. Will he not become anxious because of his socioeconomic factors? And whether substance abuse itself leads to anxiety or substance abuse is a product of anxiety, that is debatable. Next slide, please. Sir, next slide. Is it not?
Yeah. Symptoms of anxiety, sir.
The anxiety symptoms are, you have excessive worry or fear. You have seen in this picture also that the person has excessive worry and a fear is also seen. Restlessness or feeling on the edge, difficulty concentrating on a usual day-to-day work also, you become fidgety. There are sleep disturbances, but I won't say that they are severe enough, and you get palpitation, sweating, whenever something is going to occur, like examination. So you start getting palpitation, sweating, you become anxious, sometimes you are fused also. Next slide, please. So what is the treatment which we will be seeing and discussing will be CBT, psychodynamic therapy, and a talk therapy. You all understand that this talk therapy has come in because many parents are not talking with the adolescents on a regular basis. And that is why we doctors have to come in to give this therapy. CBT, everybody knows that there is ABC, the event which is not in your hand, and the belief which ultimately decides what is the product. And if we change the belief, then we are not worried, we are not anxious. Lifestyle changes which are there, that is exercise, mindfulness and relaxation technique. Dr. Padma Shri, Dr. Pukhraj Bafna is expert on it and he's going to talk about it. It is breaking the stigma of anxiety, accepting that you are anxious, accepting, yes, acceptance of any problem is a first step towards treatment or towards becoming all right or towards the remedy. Encouraging to seek help without fear is more importantly should be done by the school teacher and even parents also, that in case their child, they are finding him to be very anxious every time when stress occurs, then they should encourage him and bring him to the adolescent consultant. Next slide, please. The picture looks similar, but there are all the emotions which are different than the previous slide which you have seen. And all the persons who are attending, please note them down. Please see them carefully, because this is something little different. Next slide, please. Depression prevalence, one of the studies which they have done, that is multi-centric studies also in India, that they found that the depression, the Indian statistics is 31% to 57% in young people. When we say young people, you may say up to 25 years of age. The prevalence is 1 in 7 as far as UNICEF is concerned. 1 in 7 adolescents between the age of 15 to 24, that is, we are including young adult also. That is very bad percentage. We have to do something. And that is why the importance of early intervention is prevention of long-term issues like substance misuse, self-harm, that is suicide, or harming something, or going on a bad thing like stealing, crimes, and academic failure also. Next slide, please. So the DSM-5 has really, for a diagnostic purpose, they have lined up criteria for major depressive disorders. The first is depressed mood. That is feeling sadness. Somebody has already written it that both the children looking at both the pictures had sadness, but the emotions in sadness on both the faces were different. Feeling emptiness, hopelessness for most of the day. Second would be loss of interest. These are the headings. Remember, depressed mood, loss of interest. Marked diminished interest in pleasure activities also. Diminished interest could be generalized, but wherever the activities were pleasurable for you previously, if you are losing interest, that is one of the criteria. Significant weight loss or gain is because of either you are not eating or you are just eating because you are depressed. Next slide, please. The fourth is insomnia or hypersomnia. Either you keep on sleeping or you don't sleep for nights and nights and nights. Those who have gone abroad or had a long flight, they know what sleep deprivation means and what are the things which can get exacerbated because of sleep deprivation. Then the fifth criteria is psychomotor agitation or retardation, that is restlessness or slowing down on physical movement. You don't want to do anything. So this is one of the things which people sometimes diagnose it as hypothyroid also. And that is why one of the differential diagnoses of depression would be hypothyroid also. Fatigue or loss of energy. You always feel tired, having low energy. Next slide, please. Worthlessness or guilt, feeling worthless or excessive guilt of, see, if you have failed because you are not studying, you start feeling guilty that no, what I have done is not good, what my parents would feel, they all were very good. They are not saying anything, but you start feeling for yourself. difficulty concentrating or making decisions, and recurrent thoughts of death or suicide ideation. These are the criteria which are. Now, the next slide, please. An individual must experience at least 5 of these symptoms with at least one symptom of being depressed mood, okay, that is feeling sad, okay, empty and hopelessness, that is one symptom which has to be there, or loss of interest, that is marked diminished interest in all activities which were pleasurable for you. Symptoms must be present for at least continuously for 2 weeks and cause significant distress or impairment in your social. You are not going to school, you avoid school, you avoid studying, you avoid meeting your close friends. Unless and until you meet your close friends, then you cannot really come out of this depression and other areas of functioning also. In a relationship also, then you are not interested in meeting your girlfriend or a boyfriend because you are feeling depressed. Next slide, please. The key differences in that picture, again we have those pictures. Please try to put it in front of your eyes between anxiety and depression. And the primary emotion of anxiety is fear or worry. And in a depression, it is persistent sadness, hopelessness, and emptiness. So there in anxiety, fear is the more important, or worry is the more important criteria. Behavioral responses in anxieties you avoid. In a depressed, you withdraw yourself totally, or you sit in a dark room and just brood that what is happening, or excessive guilt. Physical symptoms are vague, but anxiety will have rapid heartbeat and trembling, which does not occur in depression. Impact on daily life, both have a big impact, but depression will lead to a profound impact. Sometimes anxiety and depression can coexist. I think last time also MKC sir has said that they can coexist. So depression, and remember, the anxiety may not require pharmacotherapy unless and until it is severe, but depression definitely would require pharmacotherapy. Next slide, please. The scales which we normally use are these, and I would request all the audience, all the students, to please refer to textbook of IAP AHA textbook of adolescent medicine. Another book which is written by Dr. MKC Nair on adolescent medicine, and the third book which is written by Dr. Swati Bhare. Please go through them. In AHA IAP textbook of pediatrics, all these scales are given. Okay. HEDES is very important psychosocial history. Without HEDES, we cannot go ahead, and we will be sharing you these scales also, and the HEDES history taking also. And in that book, the HEDES has been elaborated so well, and I'm thankful to Dr. Geeta Patil that she could publish this book during her tenure. Pursued stress care, generalized anxiety disorder, 7 GAD, 7 scared, that is screen on child anxiety related disorders. This Dr. MKC Nair always talks about these scales, PHQ-9 and scared, then the Beck's depression inventory also. What is important in these scales is whenever you are referring to these scales, remember to be very careful. Otherwise, you can misdiagnose and misquote things which are not there. Because in the scoring system, sometimes it is 1 to 4 or sometimes it is 4 to 1. Next slide, please. Something about patient health questionnaire 9 interpretation. This is the most important thing which can give you some idea whether the depression is severe or the depression is mild. So if and whether the patient should be referred or patient should be given pharmacotherapy or patient would be all right with minimal intervention. So 0 to 4 score would be minimal, 5 to 9 will be mild, watch, repeat PHQ after follow. Maybe your talking to him may give him some strength to come out of this depression. 10 to 14 counseling would be necessary. Pharmacotherapy may or may not be necessary. Above that, pharmacotherapy is a must. And remember, as Dr. MKC and the 20 to 27 is you have to refer the child to psychiatrist because it is beyond your expertise to do it. MKC Nair has also warned you last time that whenever we start pharmacotherapy, the next slide please. CBT, I have already talked about it. Next slide please. Interpersonal therapy would be that there would be group therapy, 1:1 talk, or there will be selected the same interest people who are meeting together or something like that. Whenever we are dealing with pharmacotherapy, remember one thing, as he has said, there the chances of committing suicide increase, and that's why you have to warn the parents and warn the child to just ring you up in case he is getting suicide ideation. So fluoxetine is the first drug which was approved, and a pediatrician can definitely use it, as he said, because if patient is at a remote place, patient cannot go, we have to see that he comes to that level, and then you avoid catastrophe. Okay, so this chart we will be providing you in the group also, so that you can understand. Every drug has to be started with a minimum dose and then increased either after 2 weeks or either after 3 weeks or either after a few days till you get a report, till you get a response. Do not stop the drug immediately. Whenever you feel that the counseling sessions are going to give effect, then only you reduce down dosages and then only stop it. Next slide, please. If there are any more questions, please put it in chat box. Thank you very much.
Dr. Kotwal.
Yes, sir.
I would like to add something. You have very nicely given your version about this, but some important contributing factors on depression would be, as you have said, poor family support, inadequate parenting, and use of corporate punishment by parents and teachers is also one of the important factors for depression. Death of close family members or frequent change of school is also the contributing cause for it. And I would suggest some red flag signs we should remember as pediatricians for depression, like suicidal tendencies, like development of psychotic symptoms, like lack of parental supervision and support, problem of school, family, and social activities, comorbid substance abuse, and all these, they need referral, I feel. So untreated depression patients must be referred to the psychiatrist, that I feel. Thank you so much.
That is why this PHQ-9 scale is very important to decide which are the patients which have to be referred. And as you rightly said, that nowadays the stressors are much more to become more anxious, or the stressors are much more because the family support is not there, the friend support is not there, and there are other issues which were not there previously, are relationship issues, the breakups. All these things can lead to a feeling of getting cheated, and then feeling of guilt that why I was cheated. It was my fault. and sometimes you take the fault so much on your body that you become depressed. Socio-economical, yes. Then another factor which is nowadays there is divorce rate, or after COVID, single parent because of the death of the. So those trauma factors also led to more incidences of depression, and that is why post-COVID you will find that the people are more agitated amongst professionals also. Thank you.
So Dr. Kotwal,
Yes, sir.
I think so we can now proceed to illustrate whatever we have been talking about.
So
And
Dr. Shamik Ghosh and Dr. Deepa Janardhan, these are the two actors which we have at the moment. They are stalwarts in their field, but they are another thing is that they are wonderful actors. In the first skit, you will hello, and you will have to diagnose what they are trying to present, how they are trying to present, how they are going to act, what are the things which they are doing, and what are the things which you think that they should be doing. So in the first, I think Shamik Ghosh is acting like a doctor.
yes, sir.
Yes. And Deepa is the poor patient who has come down to the well-known doctor, Dr. Shamik Ghosh. Please start. Thank you.
Thank you so much, sir, and a very, very warm good afternoon to everyone who has joined in today. Just in case for first-time attendees, please don't get worried by these different scales and inventories that we've been talking about. The organizers will be posting all of them in the groups so that all of it is very clearly and easily available to all of you. So before we start, I would just take a couple of minutes to share my screen and try and tell you exactly how we would be going about our history taking. So Dr. Kotwal did mention about the head screening, and this has been done for years together as one of our primary tools by which we try and elicit history in mental health issues in adolescents. Now, there has just been a slight modification to this, and this change is for the better. And this modification is known as the shades. Now, what is the shades? It is a modified head screening. And what are the changes that have been brought about in shades as compared to heads? There are basically three changes. One, in heads, you would straight away explore the home environment. Here, we are starting with addressing the strengths of the individual. You increase the worth, the value of the person whom you are interviewing by trying to begin with the strengths. School is addressed before home. Home is a very controlled environment. Sometimes expressions of adolescence are not very forthcoming in a controlled and a well-monitored parental environment. But when a child is with their peers in adolescence, that is where their expressions of guilt, anger, happiness, all the emotions of adolescence, they start getting expressed. Hence, in shades, school is addressed before home. In shades, there is a scope for addressing a wider range of emotions rather than just depression and suicide. And this is what we are going to be following in our two skits as an illustration. Thank you very much for... So S would stand for strengths, S would again stand for school, H would be for home, A for the activities, D for drugs and substance use, E for emotions, eating and depression, sexuality and safety of the adolescent. These are the points under which we would be taking the illustrations. So if Deepa is ready, can we go on?
Shamik, it is there is a great logic behind changing the third S, because unless and until we take strength of the child first, he won't open up and help you in solving his problem.
Exactly.
Now, this is Ayesha, who is a 14-year-old girl child exhibiting low self-esteem, affecting her relationship with parents and with peers also. And that is why the parents and Ayesha has come down to Dr. Shami Ghosh.
Thank you, Dr. Kotwal. So this is the setting is of a pediatric clinic. It's a private consultation adolescent clinic, and Aisha has come in with her parents. So we begin. Hello, Aisha. We do know each other for long, don't we? I'm so glad we've got this opportunity to meet up. I can notice that you've come here with your parents, and how would you like this to go? Before we start, I must emphasize that today is for listening to your point of view. It's for you to decide. Do you have something to say on your own while your parents are here, or would you want this conversation to be a one-to-one with me?
I really am not sure why am I here. My parents forced me here. But yes, my parents are not happy with me. My friends don't like me anymore.
Aisha, you've been a lovely child since I've ever known you. Today you've grown into this wonderful young lady, and we are here primarily to listen in and be equal partners to try and make you feel better.
I have nothing new to tell my parents. They know me since childhood. But of late, they appear to be strangers to me.
Aisha, I can understand your feelings, and you are transitioning from childhood to adulthood. So there are possibly a lot of independent thoughts, there is a lot of freedom, and I must emphasize there is also responsibility that comes into this age. But since you mentioned that you have nothing new to say to your parents, uh, if it is all right with them, can we have this as a one-to-one talk with you today, just to get to understand you and to know you better? Is that all right with you?
I wonder if anyone will ever understand me. But yes, I'm willing to talk to you, doctor, one to one, just to see what's ailing me.
So the parents, they leave the room, and the doctor starts his shades assessment. Aisha, uh, your parents have been really nice to report your steady academic progress, and also they take a lot of pride in your academic achievements. But I wonder, are there other creative or sporting achievements that you have that we have not ever spoken about or I don't know about?
Doctor, I used to love singing and painting, but I don't think I'm good at either. Never won prizes, nobody appreciates me. And sports, no. Nobody in my family even exercises regularly.
Okay, Aisha, what I can figure out is that your creative skills can do much better if they are properly nourished. Is it also right for me to say that you're not particularly averse to sporting activity if you have the right role models? That's a wonderful insight, Aisha. Thank you so much. Coming to school, is there anything in school that attracts you? Is there anything in school that's not particularly to your liking?
Doctor, I told you, no, I'm not good at anything. Most of my classmates are multi-talented. Who wants to be friends with a person like me? And my teachers doesn't think that I even exist.
So, Aisha, what I can figure out is that though you've been at school from early childhood, there seems to be some kind of a disconnect that you're having with your friends. Maybe it's quite possible that now that you are near your board exams and your academic pressures are increasing, maybe you people have very little time to interact with each other. Let's come back to your home. I do know you're the only child of your parents. How has it been living with them?
Doctor, dad is a very busy person. He's hardly at home. And my mother, I don't know, her expectations are sky high. She doesn't know what my potential is. And there's a lot of silence in the house, which is quite unbearable.
I completely understand, Aisha. There seems to be a breakdown in communication. So, this is something we really will have to work upon. Thank you for that. Uh, Coming to your leisurely activities, anything that you love to do to relax and to unwind?
Doctor, I told I like music. I do some painting sometimes, but at the end, I find solace in mobile only. And friends have no time.
We
So,
can't
what,
hear Deepa, Shamik. We can't hear her at all.
Deepa, your volume?
Am I audible now?
Are you more louder? You can speak more louder, maybe.
I listen
Yeah.
to music, I'm on mobile, and occasionally I dabble in painting, but friends have no time.
Okay, Aisha. I can figure out that most of your relaxation is all by yourself, and your fair parents or your friends or your parents, they are hardly participating in your relaxation time. Is that true?
Yes.
Okay, Aisha, you're not in a very happy frame of mind, as I can figure out. You're almost speaking in undertones. Now, do not answer this if you don't wish to. But at this age, it's not unnatural to try out, alcohol or tobacco. Have you ever felt tempted to do this?
I won't deny that such thoughts did cross my mind, but I have never had the friends or the courage to experiment.
I so appreciate your honesty, Aisha. It is something that we should be really appreciating you for. And thanks a lot for being so honest. Uh, Emotions, Aisha, they are a very integral part of human development. So, do the feelings of happiness and sadness, do they fluctuate within you? Deepa, you're muted. You're muted, Deepa. Yeah.
Yes, these emotions actually fluctuate, doctor. They perplex me. Some I understand, but at other times I just cannot understand why am I sad or why am I happy.
Aisha, please don't worry. One of the first steps towards understanding emotions is talking about them. That's exactly what we are trying to do now. Is that all right? So, Aisha, emotions at this age can be very raw and they can be felt to unimaginable extremes. Do your sad feelings ever lead you to think of a self harm?
Yes, it scares me. I don't think I'll ever do it. But why should such thoughts ever come to me?
That's exactly what we are trying to normalize through our conversation today. Aisha, these thoughts come to everyone. Even fleetingly, transiently, they do come to everyone. But it is our education which helps us or teaches us how to handle them. And this is what we will try to do. Aisha, just delving a little deeper, again, please do not answer if you don't feel comfortable. But have you ever tried figuring out why a person of the opposite or the same gender attracts you?
Doctor, I've seen this happening to a few of my friends, but nothing concrete has happened so far with me. But yes, sometimes I do wish I had someone special.
Right. So, once again, your honesty has to be appreciated. And human relationships, they do have their inquisitiveness, they are explored, and you should explore them only when you feel right about it. Take your time and feel free to talk about anything, which might be troubling you. Aisha, can I ask you, have you ever felt threatened at home, school, or whenever you're with your friends?
At home, there is a lot of silence, like I mentioned. I'm hardly with friends, but sometimes I feel intimidated by some friends who are loud and extroverted.
So you do wish your parents talk to you a little more, isn't it? And this feeling of intimidation, sometimes it can stem from a desire within yourself to be more expressive yourself, right? So parents talking to you, you being a little more expressive, these are things that we can work on, isn't it?
Yes, doctor.
Right. Aisha, over the last few minutes, it's been a real pleasure trying to gain some insights into what you're thinking. Uh, Adolescents, as you might be aware or may not be aware, there are new milestones which are achieved in the form of independent thoughts, emotions, and we all need a little bit of hand holding so that we can learn these skills. That's exactly what we are trying to do so that you can reach your potential. So, what are the things you specifically would want to be done, either by myself or your parents or anyone whom you think in your environment can help you to change?
Doctor, first of all, the silence at home is killing me. I want some conversations. I want my parents to listen to me, understand me. Second, I want to have some friends, maybe one friend with whom I can share everything. And third, I want to feel good. I want to feel happy about myself.
These are perfectly concrete and very doable goals, Aisha. We'll try our best to help you to achieve them. Trusts and relationships are like building a house. Every brick has to be well placed. So, can I just suggest that you can keep a written or an audio record of whatever you wanted to talk and in different circumstances, but you really couldn't express yourself then? And we will also go through some basic, de-stressors like deep breathing, engaging in a definite sporting activity for at least 30 minutes every day. Would that be all right? Keeping a record book, both audio and written, and doing some de-stressing exercises. Is that all right as a plan for you?
Yes, doctor. That sounds reasonable. I'll try doing that.
Thank you, Aisha. It's important we follow up everything that we've discussed today. But mind you, you should be ready and willing for that. So, how long would you want to take before you decide the further meetings?
Doctor, I guess I'll need some time to gather my thoughts, either on paper or as you suggested, through some audio recordings, maybe 2 to 3 weeks.
That's fine, Aisha. I hope I've been able to fulfill my promise to you today, which was basically to listen to you, to gain some insight into what you're thinking. I really, really would love to meet you as soon as possible, and then we can collectively decide when your parents can join us in this process. Thank you so much.
Thanks, Dr. Shamik.
Thank you, Dr. Shamik and Aisha. That is Dr. Deepa Janardhan. I can see a smile on Deepa Janardhan's face at the end of the interview also. For the sake of the audience, should I summarize?
Yes.
Yeah.
Yes, sir.
You have seen, everybody has seen that when the interview started or when the Aisha was brought to Dr. Shamik's chamber, she was very reluctant to talk. She had everything on her face that she felt that this interview is going to be a farce and is not going to help her out anyway. Dr. Shamik definitely used technique to relax her. Then he used the known history taking, that is HEDES or the changed modified version, in which he tried to find out what are the strengths, what are the weaknesses. She is interested in sports, school she likes it. Many teachers she likes it, but nowadays she is not interested. But otherwise she had a great affection for school going, then academic activities also. He wonderfully touched the sexuality part and the drugs part and the suicide ideation, because these are always very difficult things in an interview part, because sometimes they get withdrawn and the interview ends there. Once you suddenly ask them, you must be having some relationship. What happened? Was there any breakup? I mean, that takes them on a back foot. That one, that they are caught. Second, that they are basically feeling guilty of the event, and now it has been exposed. And but you tackle that very easily, as if you are asking, what did you eat for your dinner? So if the doctor's face does not give any indication that you are talking about some awkward areas, then I think the patient can easily relax and answer your question easily. You wonderfully took out options from Deepa only, that what she would like to do ultimately. And the great part is in the first interview itself, if a person comes out with options, that means you are on a very right track, because otherwise they would say, no doctor, I don't think, I don't know, I mean, I will think, and that way. But she gave options that yes, she may like to. I mean, that was a clue for second interview, third interview, fourth interview, and then family together interview. Wonderfully done. Parental counseling is necessary was another point which you got it from Deepa. Deepa said that, or sorry, Ayesha said that nobody is in a talking mood in the family, and probably the expectation part from the family is also different than what she thinks about her own life. Very well done. And so, Dr. Hema Bindu and Dr. M.K.C. Nair, Dr. Pukhraj Bafna, sir, please add.
Sir, it was an excellent
Dr.
play.
Prashad.
It was an excellent play, and so natural it was. Deepa was looking so disgusted initially, and Shamik interviewed her so nicely. It looked like it is at his home. The only message I would like to give to Deepa, I'm sorry, to Ishika, is in Hindi. Ishika, जोश कभी कम न होने देना, मुसीबत में खुद को कभी रोने न देना, यकीन रख सच होंगे तेरे हर सपने, खुली आंखों को कभी सोने न दे. That message I want to give through Shamik to Ishika.
Thank you, sir.
Thank you, sir.
Dr.
Thank you so much.
M.K.C. Nair, sir, is here. From my side, I think it was looking very natural, and the flow from one section to the other went on without even realizing that you're jumping into some other topic which is more sensitive. And it was not very intimidating. The way you have asked these questions was very non-intimidating, and it was very comfortable for the adolescent. Of course, Deepa was looking very low, and then she slowly brightened up. It was happening with her voice also with the net. Anyway, I think everyone, each one of us, when we start doing, we'll have own stories, and we can have our own ways to do it. Yeah, and Shamik has shown one example how we can do. So it is a very nice way to show, instead of only having a lecture. It was nice to see actually how a talk can happen, how a conversation can happen with an adolescent. So it was excellent, Shamik. And Dr. Deepa, excellent. And you were really behaving like that adolescent girl who was not interested and isolated at home with such things. So thank you. I think it was great for both of you.
Now you will see Deepa in a different role. He'll be, as as a doctor, she'll come, and Shamik has to be very bold adolescent.
Now, now I would allow Dr. Kari also to comment on this particular skit.
Sir, you
Prashant.
all are experts. So you all have said a perfect thing. Only thing, one thing which has been asked in chat by Dr. Parimala, Dr. Samik, if you can answer that, only reassuring Aisha, but should parents also be counseled? And what will be the best way to counsel parents along with the Aisha?
Yeah.
That they want to ask.
Thank you for the question. So here the index case is the adolescent, and this whole session is by no means a solution to all her problems. It is just an icebreaker. The parents will be coming into the picture and will obviously be playing a very, very important role once the adolescent is ready to solicit their cooperation. As of now, there are walls between the parents and the adolescent. So it is up to the counselor to try and break down these walls. So some of the dialogues, if you listen to, we've been trying to break down a few of those walls by telling her that a lot of her academic activities were being reported by her parents with a lot of pride. They actually are probably facing a hard time trying to understand her, and maybe in the future, when we can get them to talk to the adolescent a little more, maybe spaces would open. So by no means is this the only session. This is just an icebreaker.
Yeah, and
Actually,
somebody had asked Richa that how long this counseling usually lasts. So first session usually lasts for 45 to 60 minutes, which they have cut down to around 10 minutes because of the time. But wonderfully done. So good going. And thank you so much.
so there's
Thank
one
you.
question which I asked earlier also during rehearsal. What if Aisha is not ready to talk at all?
Well, let's be very clear. This has to be a two-way traffic. If she is not willing to open up, if she is going to keep completely mum, we will have to terminate the interview. We can offer some courtesies like, having a cup of coffee and then resuming conversation, or asking her if she wants to come in another time. But at the end of the day, the adolescent has to be motivated. And sometimes the first steps of counseling, that is motivational counseling itself, can take 2 to 3 sessions. So if someone is in the pre-motivation phase, is not motivating any change, pre-contemplative phase, then we may need more than one session to even start the conversation.
Thank you,
Very
sir.
good.
Thank you.
Very good. I think ice breaking is very important, and ice breaking may not need to breaking the ice, and that is why you will have to give time to the adolescent. Always remember, my message would be keep your doors open. Never say you are not talking, so there is no point in coming, so we end this conversation. Instead of that, we should end it in a positive note so that she keeps on thinking and phones you up for a second appointment, and that time your interview goes on very well. Dr. Shamik, you used these counseling skills also, like paraphrasing and mirroring. Okay, so you use them very effectively. Can you elaborate on these two for the sake of audience?
Yeah, I mean, a very important part of counseling as we go through our training in counseling methods is to try and summarize and paraphrase whatever has been expressed, because whatever thoughts are being expressed by the adolescent, it comes from a very confused state of mind. The moment we can give it some objectivity, the moment we can tell the adolescent exactly why she is feeling whatever she is feeling, and whether there is something positive in her thoughts through which we can work upon her confusion and clear the confusion, that is where paraphrasing and summarizing whatever she has expressed or he has expressed comes into play. It comes with practice, wherein we are basically trying to clear the muddle. We are trying to clear the confusion in the adolescent thoughts.
Thank you very much, Dr. Shamik. Should we go to the next case?
Yes, sir.
You have seen Shamik as a very, very patient doctor. Whereas basically, whether he is, let us see him in a very different role of a difficult adolescent. And Deepa, who has now exchanged the role, becomes a counselor, adolescent counselor and a doctor for a very, very difficult Shamik. Shamik is taking the role of Rohan. Rohan is a 16-year-old male exhibiting rebellious behavior. I would like to first ask Dr. Pukhraj Bafna, what does this rebellion adolescent mean? That means he is not answering, giving back answer, not attending school, or creating problems, or much more. Can you please put some light on it?
I have got a set of slides for these people. I'll answer that. Meanwhile, you can
Okay.
go ahead with your.
Okay. So let us go to this case, and you can please start.
Sir, am I audible now?
Yeah.
Uh,
That is
so-
not your usual style of speaking loudly, but you will have to make it.
Sure, sir, sure. Hi, Rohan. I'm Dr. Deepa. I really appreciate you sitting down with me today here. And this space is just for you. Like, whatever you say will be between us. Unless something comes up that affects your safety or someone else. Does that feel okay with you?
Yeah, it's okay.
Thanks, Rohan. I know your parents are concerned, but I would really like to hear how things have been from your point of view. How have you been doing lately?
So, doctor, if my parents are so concerned, why don't you just speak to them? Why have I come here?
I want to know from you, Rohan. I just want to know how things have been from your side. They have told me about their concerns, but I really like to know what's bothering you.
Doctor, I am a problem. I am a real problem. Everywhere I'm a problem. At home, in school, everywhere I'm a problem. So if I'm a problem, why have I been brought here? I just want some space for myself.
Rohan, so it sounds like you are feeling misunderstood at home, and maybe you just need a bit of space to figure out things. I appreciate you being open about that, Rohan. Rohan, before we talk about what's been hard, I would like to know you better. I would like to know some things like you consider as your strengths. What are things that you enjoy doing?
I'm glad you're asking about me rather than what my parents are concerned about. Just to let you know, I can skate, I can play the guitar. I may not be amazing, but I'm working on it. I'm trying to achieve something. And doctor, some of my friends tell me that I can be very funny.
So skating, music, and humor really matter to you, Rohan, and you are seeing progress in those areas. That gives me a great sense of your strengths and the ways you recharge. Now, Rohan, can you tell me something about school, your teachers, your friends?
Do I have to? This school where, nobody considers me as a friend. And, they went and gave my parents something called a suspension letter. Can I even go back to that school? I hate my school. I wouldn't even like to talk about it.
So, Rohan, it feels like school is somewhere you just go and come because you feel you're being labeled, you're being misunderstood by your teachers, your friends. Thanks for sharing that with me. Now, how about home? Whom do you live with? And what is it like at home these days?
Doctor, I have mom and dad at home. My brother is there, but he's done well for himself. He's gone to college. But now that he's in college, there's always tension at home. Everyone is mad at me all the time. Everyone has something to lecture me about all the time.
So you live with your parents and with your brother as time being away at college. So it sounds like home feels pretty tense with some kind of conflict or pressure in the air. So when you're feeling stressed, what do you usually do to unwind? What are the activities that makes you feel good?
I hate to be at home. I hate to be at home. I hate to go to school. But yes, possibly, if I get some of my friends, I can hang out with them. Like I said, I love to skate. Music is something that I like. There's some lovely food joints that we visit. And since I hate to get back home, we are sometimes very late in coming back.
So Rohan, being with your friends in relaxed spaces gives you a break and helps you feel more like yourself. I appreciate your openness. Now that we have talked about your friends, I would like to know something more about your friends. Does your friends anytime tell you about smoking, vaping, alcohol?
I've had a few drinks with friends. I guess it's natural at this age. Uh, a few of them also engage in what they call vaping, but I haven't really been attracted to that. But yes, I've had a few drinks with friends.
So you have been around it, tried a bit, but it's not something you are really into it. Thanks for being honest. It helps us figure out how to support your choices. Rohan, how have you been feeling emotionally? Any ups and downs?
Doctor, I don't know what's happening. I just feel very mad some days, and some days I just switch off. I really don't know. Why should I even be bothering about anybody? Whether it's my parents, whether it's my school, whether it's my home. Why bother with anything?
It sounds like your emotions swing between anger and feeling kind of stuck or drained. It's important to talk about, and I'm glad you shared that. So, whenever you're feeling low, do you get thoughts of hurting yourself? Or like you feel like you and your family will be better off without you?
Uh, to be very honest, doctor, I don't think I will do anything like that. But I can't also deny that those thoughts did cross my mind. But no, I will not do anything like that.
So, Rohan, sometimes those thoughts come up even if you are not planning anything. Thank you for trusting me with that. Talking about it is a strong first step, I would say. Now, let's talk something different, but uh, just answer me only if you're feeling comfortable. Uh, like, does any of your friends are into relationships? Do they get intimate, or are you seeing someone?
Doctor, that's the only bright spot I have in my life. I've been seeing someone. We kiss occasionally, but my parents are not aware of it.
So that means you're exploring a relationship in a way that feels right for you, and it is something you want to keep private for now. So that's
Yes,
totally your
doctor.
call, Rohan. Yeah. And if you ever have questions, I'm here to answer. Rohan, do you feel safe at home, school, or when you're with your friends or anywhere? Do you have any
Doctor,
concerns of
I
safety?
told you that school has suspended me, for no fault of mine own. So I'm not going to go to school. Home, please speak to my dad. He can't say a thing without yelling at me. What does he think? And the home atmosphere is killing, it is stifling.
So you're really concerned about the atmosphere at school and you're yelling by your father. So it's important to know, and we can keep checking it on that too. So, Rohin, today you have given me a clear picture. Thank you for that. So, based on what we have talked about, what are the few things you would like to work on?
Doctor, I think so. Today has been one place where I have spoken and spoken my heart out. So I really, really want my parents to hear me, not just order me around. And I'm really sorry, doctor, if I have not been able to control my temper. And I really want to control it. And something more I want to ask you, doctor. I don't want to pretend that everything is okay. I want to stop pretending. I want to be my real self. And especially when I'm down, I want to tell people that no, I'm not feeling well. These are the three things I want.
So, Rohin, your goals are about being heard. You need to manage your intense emotions, and you want to find better ways to express what's really going on inside you. That's a solid plan, and I'll be honored to help you work on it. So let's start small, Rohin. How about keeping a journal or audio log to track your mood and stresses? And I can also show you a grounding exercise. Have you heard of box breathing?
I haven't heard of it. If you can teach me, maybe I can try that.
When you feel your emotions are out of control and you're feeling too angry or something like that, just try box breathing. What is box breathing? Just inhale for 4 seconds, hold your breath for 4 seconds, exhale for 4 seconds, again hold for 4 seconds. You can keep repeating this cycle till you feel you are under control, your emotions are under control.
I think
Is
so.
that
I can do
doable?
that. Yeah, I can do that.
So please do these both, journal and box breathing whenever you need. Okay. So Rohin, as you want your parents to better understand you and spend time with you, you try talking to them about this. And later we can do a family meeting if and when you are ready.
No, 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 doctor. No way. I don't want to meet them. They'll start lecturing me again. I'm done with them. Please, please allow me my space.
Rohan, it looks like you are at present not comfortable having a meeting with your parents around. That's quite okay. We will do it only when you are ready.
Thank you, doctor. Doctor, since I've been able to at least talk to you, could you give me a number so that I can call you or whenever I need some help? Because I feel quite helpless.
Definitely, Rohan. I can give you the contact number of my clinic. If anything urgent is there, please inform the front desk staff and we can have a meeting at the earliest.
Thank you, doctor.
Rohan, when would you like to schedule our next meeting? We can see how things are going.
Okay, doctor, if you're there and if I can get to talk to you, one-on-one, I think I can handle that. But parents, just keep them out for the time being at least. And maybe 2 weeks from now?
Sure, Rohan. I'll book that. I really appreciate your honesty today. And this kind of conversation is actually a big deal. And it shows you are thinking deeply about where you want to go. Thank you once again, Rohan.
Thank you, doctor. Thank you, doctor.
So that was it. Over to Kotwal, sir. Kotwal, sir, are you there?
So you have to unmute yourself. Unmute yourself, sir. Can the host? Yes.
Now, yes. Actually, I was not supposed to unmute by the central body. But then I am a rebellion person. So ultimately, I could unmute myself.
Wonderful.
It was a wonderful discussion between you two. And really, in this particular case, what the child was trying to say is the parental attitude should be more of understanding, and they should come on one platform and talk with each other. So he was asking indirectly for that help from the counselor. I would request Dr. Pukhraj Bafna to elaborate on this particular
Sir,
case.
I would like to say in this connection, it was such a nice play, excellent. The role play by Dr. Shamik was, I mean, I just could not imagine even the people at.
What a typical rebellion boy.
Kya baat hai, kya baat hai. One thing I would like to suggest in this matter is parents have to find time to speak with the children, not to the children. Talk with the children, not to the children. उनके मन में झांकने वाली बात है. So in this matter, I have got some slides I would like to show. If you want, I can start with that.
Yes, sir.
Yes, sir, yes,
Please.
sir.
Please. First, I'll show the difficult teen and then the relaxation techniques together.
Excellent, Shamik.
Thank you,
And
ma'am. Thank you.
the
Can
way
you
you
see
said,
my
I
slides?
don't want your parent. That was so good.
Can you see my
Yes,
slides?
sir. Yes, sir.
Okay. See, next. The teen who is perceived as non-cooperative, as Shamik was, or not fitting into the expected frame of behavior is a difficult teen. We can call them terrible teens, we can call them terrific teens. The other name could be troublesome teens, turmoil teens, and challenging teens. In Hindi, उम्मीदों के फ्रेम में जब फिट नहीं हो पाते, then they are called different teens. When the adolescent is reluctant to modify, as Rohan was, the behavior he or she is considered as difficult. No, I don't want to talk to my parents. No, I'm like this. I'm like this only. Nobody listens to me. So that is a difficulty. Why and when? When the adolescents are treated badly, they become difficult. When they are not taken seriously, as Rohan was very, very serious about this, that he is not being taken seriously at his home by parents. When there is change in our society, and when there is parents' indifference, there is misunderstanding between the parent and the adolescent. And mass media, of course, as we know very well, the only thing adolescents want to say is, as Rohan said, nobody understands me. Who can help them? First, teenagers themselves. As Dr. Deepa said very well, that you can do it yourself. There is a great role of parents. जो संस्कार हमको बच्चों को देना है, that is the biggest thing. As I have told you, they have talk with the children, not to the children. Teachers have got a great role, and then they come to the specialists like you and me and pediatricians and psychiatrists, and of course the government has to have a very big role to play, which सरकार हमारी सो रही है इस बारे में, बहुत ज्यादा कुछ हो नहीं पा रहा है. Next, when do they come to us? Adolescents are usually brought to the attention of the clinician or pediatrician or the counselors when the social functioning is also affected and when things become difficult to handle within the four walls of parents, school, and peers. When the parents, the school, and the peers, they're all say, no, we can't do anything. When the teenager is in distress, unmanageable agonies, inevitable anguish, confused parents, and frustrated teachers, then they come to us. Then the matter of difficult teen comes in picture. Now what our aim should be? First and foremost, creating awareness on the various presentations of a difficult teen in the schools, in the colleges, in Mahila Mandals, among the parent-teacher meet. The second important is early identification of difficulties during adolescence. Whenever they come to us, we have to identify which type of anxiety or depression or whatever it is. And third is early intervention and management that can be offered at a primary care pediatrician like you and me setting, or if the things are difficult, which are we are not able to, then we have to refer the case to the psychiatrist. To conclude, there is a very good 2 lines about the discipline. सितार के तार को इतना न कसो कि वो टूट जाए और इतना ढीला भी न छोड़ो कि स्वर न निकले. So the key point is, and the bottom line is, a combination of discipline today and reward tomorrow works well, because these are the adolescents, difficult teens you have to handle with care. Thank you. This is about the adolescent. Now, the second part is about the anxiety, the relaxation techniques. I would like to a few more slides about it. Friends, can you see the slides? Is it visible?
Yes, sir.
Yes, sir.
See, there are so many types of relaxation techniques, but the main are 1, 2, 3: autogenic relaxation, visual imaginary. The adolescent should just go on shavasana, so jaye wo, let him sleep, let him get down to the bed and imagine that he is looking his own body. There should be auto suggestion. that my fingers are relaxing, my hands are relaxing, my legs are relaxing, my whole of the body is relaxing. And relaxed breathing, he should keep his mind on the breathing, how it is coming out, how it is going out. And relax other parts of the body one by one. Fingers, hands, legs, abdomen, neck, brain, and all that. That is autogenic relaxation. You have to auto-suggest that I am getting relaxed. Mera pura sharir shithil ho raha hai. Like Savashan. Second is progressive muscle relaxation. Tense muscle for 5 seconds and then relax for 30 seconds. Repeat from head to toe and reverse. This will give a mild relaxation. And third is visualization, mental image to take a visual journey, to take a peaceful place and situation. Just think, in your head there is a door and there are steps. You are coming down one by one and you have come to a place where there is a river flowing, cool air is going on, and you are sitting on a chair. Nice situation. This is how you can get yourself cooled. There are a few other relaxation techniques like yoga, meditation, deep breathing, as Deepa also said, taking breathing, massage, music and art therapy, aromatherapy, hydrotherapy. These all work. These all work for depression, for anxiety, and all the mental illnesses, for everybody, not only for the children, but adults also. Along with relaxation, a few positive coping methods like exercising regularly. The best would be Surya Namaskar. Then eating healthy diet, getting enough sleep, most important. Managing time and priorities. All of the tension, all the stress, all the anxiety will be over if the time is managed properly with priorities. Thinking positively, solving problems, finding humor. Humor is the best thing to release out of the tension and all the mental illnesses. Spending time outside means go to some samaro, go to some function, go to some sangat, go to some temple, go to your friends, go to your relatives, and supporting family and friends. There should be, the family should support the child, the friend should support the child. That should be, these are the relaxation techniques also. Then yoga, there are many types of yoga. Every type of yoga can relax your mind, but yoga contributes to refined relaxation and a greater sense of well-being with positive outcome. For anxiety, Padmasana, Balasana, Trikonasana, Uttan Padasana, like lotus pose, child pose, triangle pose, standing forward pose, and Vrikshasana, like a tree pose. This can give you relief of anxiety. Then for depression, we have Sukhasana. Just sit quietly with folded legs. Shoulder stand, Sarvangasana. Standing forward fold, that is in Uttan Padasana. Just like a child go to sleep, child pose, Balasana. And Shavasana is the most prevalent and the best part for the relaxation from anxiety and depression. Now, very important is meditation. Everybody should do meditation right from age of 9, 10 to 80 years. There are 4 types, popular types of meditation practices are mindfulness, most important, spiritual focused, transcendental, movement meditation, meditation with mantras, progressive relaxation, visualization meditation. These are the types of meditation, but most important is mindfulness. What mindfulness is? There are 5 pillars. Awareness, who you are. You should be aware of yourself, that I am so and so. Acceptance, whatever I am, accept it. Compassion, gratitude you should have. New beliefs. These are the 5 pillars. Then what are the 5 areas? You have to observe what is going on all around. Describe what is going on. Acting with awareness. You should be aware. Non-judging for inner experience and non-judging to inner experience. Then 5 facets which are very important are: recognize yourself that you are. Don't undermine your authority. Relax, review, respond, and return whatever you are. Now, what mindfulness exactly is? It is the basic human ability to be fully present, to be aware of where one is, what one is doing, what is going on around. It is something everyone naturally possesses. Mindfulness everybody has. The only thing is you have to just sit and do it. it is important to improve emotional regulation, most important, because emotions are disturbed everywhere, whether you have anxiety, whether you have depression or anything else. It is easy to do. It costs nothing. It is a state of mind and state of calmness, gratitude and compassion. To practice mindfulness, one has to learn pranayams and breathing methods like Kapalbhati, Bhastrika, Anulom Vilom, and Bhramari. These are the 4-5 pranayams, breathing techniques, alternate nostril breathing. These give you calmness. This gives you relief from all the anxiety and all the depression. All the above relaxation techniques cost nothing but regularity and time involvement. How to practice mindfulness? The most important, mindfulness has to be practiced by every adolescent. Focus your attention slowly and deliberately on each part of your body in order from toe to head and head to toe, one by one. You have to keep attention. Second, be aware of any sensation, what is going on around, emotions or thoughts associated with each part of your body. Bring your attention to the present moment, wherever you are. Focus.
से गुरुवार दिन अनाउंस करिवे ग्रुप बनेबे
Oh, can you stop it? Focus on your breath, inspiration, expiration. Just observe. Observe your thoughts. Observe your surroundings. What is around you, wherever you are sitting or sleeping. Practice acting, listening, active listening. Be kind to your wandering mind. Be kind to your wandering mind. So, friend, mindfulness reduces anxiety, stress, and depression. It can lower blood pressure in adults and even adolescents, they are getting blood pressure, improve sleep, and help to cope with pain. Most important bottom line I want to give to the adolescents is, of course, I talk to myself because sometimes I need expert advice. The adolescent himself is an expert for his own. That's what Dr. Shamik says. That's what Dr. Deepa says. That's what Dr. Kotwal said. That's what Dr. M.K. Sinha says. So friends, let's be with our teenagers and make it their most memorable phase of life, with them, talking to them, living with them like a friend, and be aware of all the problems which they have. Thank you so much.
Excellent, sir. Extremely excellent. Hima Bindu, ma'am. It was.
Yeah.
Correct, sir. Yeah.
So, Dr. Kavita, I think so. If there are questions that are unanswered in the chat, many of them have been answered.
Yes, Rajesh sir answered many questions.
Yeah, before we answer those questions, I would like to add up which I had not added up in my presentation is, before labeling the child, whether he is suffering from anxiety, depression, or a difficult teen, please keep few things in mind. That NMDA receptor encephalitis also manifests with a behavioral problem sometimes, and they many a times are referred to pediatrician from a psychiatrist. Then hypothyroid also could be looking like somebody who is now started not taking interest in day-to-day activities. So do not jump to conclusion. Then the brain chemistry is very important in cases of abuse, because what is coming out as a child who is rebellion is suffering something inside. There are some genetic disorders which are prone for psychotic disorders also, and some illnesses also which manifest with such type of thing, or some tumors also which can manifest with such type of thing. But remember, if a person is ill, this won't be a single entity, single symptom that is representing behavior change only. There would be associated other things. If there are associated other things, do not miss them. That's all I want to add.
So may I add one point? I just want to add one point, like statistics has shown that around 50% of the youth who die by suicide. Am I not audible?
Yeah, you are.
You're
You are.
So statistics has shown that 50% of the youth who die by suicide had a primary healthcare visit the month prior to that. So that's a golden chance for us to save lives. And in a busy practice, it may not be possible to take the whole shades or heads, and we may not have the perfect setting. But still, we can ask 3 questions. Just simple 3 questions. One is, how is school going? To any adolescent who comes to you, please ask, how is school going? Second, how is life going? Or you can just ask, would you describe yourself as pretty happy or stressed? And third question you can ask, whenever you're feeling stressed, how do you handle it? Whom do you go for help? So if you can ask these 3 questions and anything comes out, then we can go ahead with the proper shapes. I think that
Very
is
right.
doable, and that we can pick up, we can save lives that way.
One question I would like to ask, like when you were taking interview of Rohan, so if he in your first visit accepts that, yeah, he's taking some drugs and he's sexually active also, so then like how would you proceed? In the first meeting only you will try to handle that situation, or in the further meetings will plan it?
First meeting, actually our purpose is to take a therapeutic history, not a thorough history. We just want to get an outlook of him. But then if there is something that comes out, we can just dig a slight deeper to it, but keeping in control, like we should not lose the rapport with him. So we can just go into how do you get, when did you start, how often you use, how do you get the money to buy these things? So that way we can just proceed, just go deeper. But the moment we feel he is not comfortable, you have to stop there.
I think,
And we can
Kavita,
proceed.
the first visit should be mostly rapport building.
Yes.
As 3 or 4 questions he asked, that should be a rapport building, and then one by one, and everything cannot be done in one sitting. It has to be so many sittings, follow-ups.
And someone has asked, is it really good to give your phone number?
No,
Entirely depends.
उसकी पूरी रातें खराब कर देगा वो. That adolescent, that Shamik is very dangerous person. See, if you give your phone number, you will not be able to sleep at night.
No, I also feel, sir, I want to share my experience. That was long back. When we started a Yuva clinic, there was, this, they asked, and I very enthusiastically started giving the numbers. But later it became so difficult. It's better to give the office number.
So, ma'am, just a difference that somebody who has asked in a regard that the adolescent who is having a depression or at night time some issues are there. At night time, your clinic front desk is not working. At that time, what?
Crisis number, okay. In terms of crisis.
Yeah. So it was regarding crisis. I mean, Dr. Parimala has asked.
Okay.
So I think whenever you are in the interview, you find some certain things like there is self-harm, there is an abuse-like thing, or there is a suicide ideation. I think these are the right situations where you are justified and helping the adolescent. But otherwise, if the child is only anxious, he may ring you up again and again because that is not a very serious type of illness. But he will keep on becoming more anxious and try to phone you up. But these are the things. And Kavita, what you said rightly was drug abuse and sexually active. What everybody's consensus opinion is, you have to give him a hint of what are the things which come under not legally allowed, and what is, but that is a hint, and we don't attack that problem right in the first meeting. But we give it a hint that is really not acceptable in a very polite manner, that, oh, I see, is it? But do you know there are consequences of this? I mean, that is the end of the conversation, maybe at that time in the first meeting.
Okay. So one more question. When we asked about some suicidal tendencies, जैसे दोनों ही cases में जो discuss हुआ कि ख्याल आता है, but try नहीं किया. So now जो answer है patient का जो मेरे साथ हुआ है, मरने की इच्छा होती है पर मैंने कोशिश नहीं किया है अभी तक. So now what is the interpretation of this? मेरे को उसको parents को बताना चाहिए या नहीं बताना चाहिए?
बताना चाहिए. This is a red flag. This is a red flag. One should remember whenever there is any ideation of suicide, that should be taken very seriously.
As I think Deepa has, has
Sir,
in their
can I
interview
add?
state
Can
that
I add here something?
elaborate on these things. Okay, elaborate on these. What ideas you are thinking? Have you thought of what type and this? That way you will know the seriousness of these thoughts in the first place also. Sushma ji.
Yeah.
wants to add.
Regarding that question of Dr. Kavita's, how the suicide ideas and all that, even once whenever the adolescents, the studies show that around 75 to 87% of the adolescents, when they are passing through the phase of stress, right, they would try to end up their stress by taking what is the softest way, like ending the life. They want to end everything by ending the life. So that a flickering thought of ending their life comes to them. But here we have a good scales which are very simple to perform, which helps us identify the severity of that thought process. Right. So there are CSSRI, there are PHQ-9 modified for teens. So these are two scales which will give us an idea how much serious they are. Right. Another thing is regarding talking to the parents about these ideas. Yes, of course, we need to tell them that he is or she is passing through so much of stress that, the adolescents, sometimes they act impulsively. So two things we need to do. One, the keeping under observation and in a warm, affectionate environment. And second thing is keeping the environment safe, where the means of suicide, like, the knife or the pills or the rope or some poisonous things, should not be easily available, because it's just a matter of, few seconds when the impulse comes. If it is strong enough and the means are easily available, even a flickering thought can end up into an attempt or a completed suicide. So these two things we need to know. Another thing is regarding giving the phone number. There is, for the adolescents who have suicide ideation or severe mental health issues, right, there are safety plans available. These plans are very, very helpful in our practice. They're freely available on Google. These plans contains their warning signs whenever they are under stress, what type of a warning sign they feel. Another thing is their strength. How can they divert their mind from such negative thought process? Third thing is, what are the contact number where they can approach? Here, not only the contact number of their trustworthy parents or the elders or their friends, maybe teacher, they will come out with some people's phone number whom they can approach anytime. You can give them some helpline numbers as well. Right. So there are area-wise helpline numbers which are available. There are a list is always updated in the month of September every year. So you can get it in Google. Area-wise helpline numbers you can provide. These helpline numbers are fantastically working. There are a 3-layered counseling system, 365, 24/7. They are working. So they can, contact any of them, and they have saved quite a number of lives. Right. So these are some of the things you can surely share to the person, the adolescent who is suicidal.
To the parents also, this number should be shared to the parents also.
Yes, sir. To the parents as well. To
Kavita,
the teachers, to the parents.
Kavita,
and to
we
the,
will be sharing the ASQ suicide risk screening test. But for the audience, I'm going to tell you, whenever you use these tools, the inference, the interpretation has to be proper, which is given in the scale below. Okay. Otherwise, may jump to conclusions and things may get worsened.
Sir, these tools are very much self-explanatory and they do not have any threatening conclusions at the end. So you just have a look at them. They are very simple to implement. They will give us how much, deeper the intention is. And this is how you can proceed. You can, even plan next visits accordingly, right? Because if the intention is high, the adolescent is under too much of stress, rather than spacing for 2 weeks or so, we can ask them to come frequently. And they are, if especially the youth, Rohan was, who was comfortable with the counselor, so they can be called upon weekly, or whenever they wish to come, they can take an appointment and come. So this is how we can help them out, and it helps, right?
In the first session only, in the first session, Dr. MKC has already said, it is easy to start counseling, but difficult to stop it, because you have to know that when to stop and when to have a more and more bigger period in between counseling. Don't break the relationship, just keep a thin line with them.
So if I can just come in with a few points. Dr. Kavita, do we have time? Just 1-2
Yes,
points.
yes, a few minutes.
Yeah. So number one, I think so what Dr. Shushma Desai has so brilliantly done is emphasize on making our care objective. The purpose of getting these scales and all these tools is sometimes, when you are a human being, you can make very subjective analysis that this person looks very depressed, very suicidal. But when you put them through the scales or through the tools, you come to scores which can tell you exactly where you are. And this is where it has helped us to make our practice a lot more objective. So then you know which to refer to the psychiatrist immediately, which one to call after 2 weeks, and which one to call after 1 week. So it's a matter of practice, but the more and more you use these tools, the more and more you will be better guided about the next steps in counseling. That is one point. The other is, all through our role play, we have also used what we call ORS. Like whenever we are counseling, patients come to us either in the pre-contemplative state, or they are contemplating some change, or they are ready for change. So especially when they are in the pre-contemplative stage, where you will get a majority of patients, that is where you have to use the ORS technique. So what is the ORS technique? It's very difficult, easy to say break the ice, but there is a method to breaking that ice. It should start with open-ended questions, which do not have yes and no as an answer. You must reaffirm whatever has been stated by the individual. You must have a lot of reflection on whatever has been stated. See if you can get something positive. And then, as the final thing, is you summarize the statements. So that is what all the paraphrasing is all about. You have to motivate this person. बड़ी मुश्किल से आते हैं to the clinic. So unless and until you are scientific about your motivational counseling, unless and until you use open-ended questions, you do your affirmations properly, you make the person feel important, that yes, you have your strengths, you have already achieved so much, right? And only from there can you break the ice. If the person feels worthless with our initial approach, very, very unlikely they will come up with something more forthcoming.
Yeah, and to add to the Dr. Shamik's points, which were really excellent, sometimes the adolescent, sometimes you feel they are too much depressed and all that. So the other way around is, they are expert in faking their emotions. So sometimes they would hide the emotions. Though they will say, I'm fantastic, I don't have any problem. And when you go through the scale, you can identify that they are actually in trouble. They have some suicide ideation behind all this faking of emotions. And so you can identify the adolescents who are faking their emotions and who really need the help. So this is equally very, very important. And, I'm sure all of you must have gone through such cases where the adolescents under too much of pain would be, laughing and making jokes and all that, or speaking too much, sometimes irrelevantly. So you can make it out that they are hiding their emotions. So this is also one of a very important red flag sign which we can identify in our clinic.
Thank you very much, madam. And I would give a word of caution for the counselor. Do not get too much involved into the emotional turmoil of the adolescent, because then you will not do your part of an adolescent counselor properly. Rather, you will get emotionally tangled, attached. Then we are really thankful to Dr. Geeta Patil for all the efforts she has taken to take out that IAP AHA textbook, in which all these skills, I would request all the persons who are going to take the certificate course, please go through the skills which are given there, and the interpretation is also properly given there in that textbook of adolescent medicine.
Thank you, sir.
Can I add one point? Just 1 minute. In all this discussion throughout this, there are two important points that we should not miss. Whenever we find that the child or the adolescent has a suicidal ideation or tendency, we had told him initially only that if there is a risk to your life, we will inform your parents. So we should make him aware of this point also. Second is, whenever you are certain about this ideation or plan, we must involve a mental health specialist or the expert for sure. Document and inform.
Excellent.
Excellent, ma'am.
Excellent. Geeta Patil, ma'am, your opinions, please.
Sorry, I was attending one. Am I audible?
Yes, yes,
Yes,
ma'am.
Geeta madam, we were talking very good words about you and the book.
Am I audible now?
Yes,
Yes,
yes, ma'am.
So I was in between.
Sunai
one
Dera, madam, can you hear us?
Yes, yes.
Geeta
Am I audible now?
Yes, ma'am. Yes, ma'am. You are audible.
Excellent discussion, I think, all the thing, but I missed something because I had one emergency to attend. So, what Sushma madam was telling, that we have to be very, very careful about interpreting the red flag signs of suicidal behavior and that suicidal contagion, because I have come across one suicide happens, uh, the suicidal ideation go on increasing, and that also we have to be careful. Some of the times they are very relieved because they would have decided particular plan to commit the suicide, and now they feel relaxed, so it gives us a misinterpretation. And apart from that, as we are talking about the suicide, if there is any information in the media is very irresponsible sometimes to depict the suicides. So we have to be very cautious that we ourselves as a counselor should be knowing what is happening in the media. So that also will help us. So I have not heard everything, but last part I heard what Sushma madam was talking, and the things are going on in the right way.
But you did not heard something good about you, that we were talking about IAP AHA textbook which
Yes,
you
sir,
have
sir. I
provided.
heard that. Thank you very much. It is not my creation. It is a teamwork creation, and that teamwork creation was really good. And as Nishikant Kotwal has told, that please go through all the screening tools. That section editor was our Sushma madam only, if I am not wrong. Sushma? Yes, Sushma was only there, and Sushma Gate have done it, right?
Yes.
We selected very important screening tools and I added in the annexure, correct?
Yes, yes, ma'am, we did.
Yes, so thank you very much for giving me opportunity.
Thank you, ma'am. Thanks a lot. I think Himabindu ma'am, can we wind up? MKC sir has already left, I suppose.
Yes.
Yeah. So, yeah. Anyone else want to say something? So, thanks a lot to all the speakers and especially Rohan and Aisha for so captivating role play. And thanks for putting so much efforts to give a clear-cut practical message to the audience. Actually, the program is meant for this purpose only. We want to learn how to do the counselings in the OPD, because theory everybody learn from the books. the practical you have shown to the audience. So this was really appreciating. And thank you, audience, for your interaction and interest. And I thank each and everyone present here. And our guest of honor, Dr. Neela ma'am, Dr. Yogesh Parikh sir, your words of encouragement means a lot to us. Thanks to the speakers, your efforts means really a lot to us. Thanks a lot to our director, Dr. MKC Nair sir. His inputs are always invaluable, though today he is not well, so we couldn't listen to him. But he's really, without him, the program is incomplete actually. So thank you, Dr. Hima Bindu ma'am, Dr.
Yeah.
Prakash. Yeah.
Yeah, madam.
Thank
Yeah,
you very much. And I would just now tell two things about the two photographs which I have shown. One is about anxiety and another was depression. In the first picture, there was excessive worry or fear. And there, in the second picture, there was persistent feeling of sadness and hopelessness. That's why the person was not making any eye contact and looking down on the floor. So that was the little difference between anxiety and depression photograph. Thank you very much.
Thank you, sir. Thanks a lot, Dr. Prakash Veer Iyer sir, Dr. Sushma ma'am, Dr. Geeta Patil ma'am, and each and everyone present here. And we'll see you with so much of this much of enthusiasm in the next meeting very soon. Thank you, everyone. Have a good day.
Thank you for everyone's patience.
And I invite you for the
Thank
evening
you.
tea, everyone.
Thank you. I
Good
was
evening.
there. I was listening to the, we used to do this actually. I'm an MRC PCH examiner. So we
Yes.
do a lot of case presentation like Shamak did. We do with role players. So I have, so I've done a lot like this. Still we have to do. We have to teach them role playing and all that stuff and to get it. So for me, it was quite fun because I'm quite used to all this. And it's so nice to see how Western eventually, we are emulating and doing that. So, like somebody says, I'm quite interested in holistic care and mental health. Ke bina, my bread and butter is pain abdomen. Liver transplants, we do around 5, 6 a month, but that's my dessert. It's not bread and butter. So, bread and butter is pain abdomen, and pain abdomen is, I think, the one of the most common manifestations that you would see. And this vomiting, dyspepsia, bloating, pain abdomen. So the amount of references that we have with psychological team is highest among all pediatricians put together in the local. We have around 6 in the Medanta. All put of them usse zyada I give, because every child you have to see, every adolescent you have to see with a lens. Like we were taught, unless proved otherwise you're guilty. So something like that, you have to have a lens. And sometimes in your busy OPD you can't. Then you really need somebody with you who has a set of questions to ask, and those red alerts you should be able to. How is the child while the child is explaining? The eye to eye connect. I think none of you mentioned that, with due apologies. Like sometimes I feel that is very useful to me in my practice, how she looks straight into me, or is she not able to look? And then I always ensure that I talk separately for 3 minutes or 2 minutes to the child. Do you want to say something to me? If she says yes, then if she says no, then still I refer to someone to see if they say, because I may be intimidating, because I'm probably an ADHD with very hyper. I like to do things very fast and quick. Maybe that's the key to my success, my ADHD. I mean, on a joking manner. But Dr. Pukhraj, I did not take picture of anybody except your 3 slides. Your 3 slides, I took pictures. I'm going to follow the mindfulness. I'm going to follow the yoga. And exactly what I started in the beginning, I said how it is responsible for us to talk about to pediatricians to improve their health, because they work so hard as compared to the other people. For the amount of money they earn, they need to put
Neelam.
more efforts. So your tips are the one. I'm taking your permission. I am good in social media, and daily I give one view. So I'm going to cheat your 3 slides, and I'm going to put it.
Neelam, 4 lines for you.
तो चोचुइट
चमक सूरज की नहीं.
एक सेकंड वीडियो जल्दी से वीडियो दो श्यामक वीडियो प्लीज
Yes.
नीलम, चमक सूरज की नहीं तुम्हारे किरदार की है. खबर ये आसमां के अखबार की है. तुम चलो तो तुम्हारे संग कारवां चले. बात तुम्हारी नहीं, बात मेरी नहीं, बात हम दोनों के एतबार की है.
वाह दिल खुश कर दिया श्यामक ये दे देना तुझे कैडबरी डार्क चॉकलेट लो कैलोरी
जरूर मैम. खुशी खुशी.
right because that's good for your health and mental health so dark
बापना सर
chocolate is
एक क्वेश्चन मेरा रह गया पूछना. व्हाट इफ द टीन जो हमारे पास काउंसलिंग के आ रहा है वो इमोशनली अटैच हो जाता है डॉक्टर के साथ तो because this has happened to me. A girl, she started like treating me as she उसकी step mother थी. तो वो मुझ में ही अपनी मदर ढूंढती थी and she started giving me gifts and उनका मेरा बर्थडे भी सेम था तो बहुत ज्यादा इमोशनली अटैच हो गई थी. मेरे को बहुत सारे एफर्ट्स लगा उसको डिटैच करने में. So actually what should be done?
Can I tell you
That's
something?
why I told
Yes,
you
yes, ma'am.
only
Transference and
that
counter
the counselor
transference.
should not get emotionally involved. They
Yes.
should keep a barrier because ultimate aim of counseling to make them independent and not dependent on.
तो सर उसको करने की टेक्निक नेक्स्ट उसमें बताइएगा.
हाँ सर. सुनो कविता, इसके लिए तुम भी सुन लो.
जी सर.
जब टूटने लगे हौसले तो बस ये याद रखना, बिना मेहनत के हासिल तख्तो ताज नहीं होते, और ढूंढ लेना अंधेरे में भी मंजिल अपनी, जुगनू कभी रोशनी के मोहताज नहीं होते.
वाह वाह
वाह बहुत बढ़िया.
that was for whom
कविता for me. For me.
मैं तो सबके लिए बना सकता हूँ लेकिन टाइम नहीं है. अगली बार एक आध सेशन ऐसी रखना जो सबके लिए रहे.
जी
एक सेपरेट सेशन रखेंगे पोखराज जी का.
जी जी जी. अभी कोतवाल साहब के लिए बोलना रह गया है, वो बाद में बोलूंगा.
So thank you everyone. We see you soon in the next meeting. Goodbye.
Thank you.
Bye.
Thank you, everyone.
Thank you.
Bye-bye.
Thank you.
Bye-bye.
Thank you.
Bye-bye.
Hope Prashant, you are giving recorded version for 2 days at least.
Ma'am, though I said 2 days, we have kept it open for 2 weeks.
Yeah.
नहीं सर वो कंटिन्यू रखना पड़ेगा ओपन क्योंकि वो हमारी फ्यूचर रिकॉर्डिंग के लिए भी होना चाहिए. कभी भी हम
क्यों
उसको
बराबर है, बट मैम फिर दूसरे कोर्स में लोग नहीं होंगे फिर हमारे.
नहीं होंगे सर क्योंकि ना ये इम्पोर्टेंट है. इनको अपन वो नहीं कर सकते. हम कभी भी इनको रेफर करें कभी भी.
कविता दूसरी
Kavita,
डेट
we'll
दो
discuss
जल्दी.
this
दूसरी
later.
डेट क्या है?
Yes ma'am. Yes ma'am.
We'll
सेकंड
discuss
डेट
this later.
नेक्स्ट सेशन.
I think 20th is I'll check it and let you know.
ना को है
इंडियन.
ना 20 को है 20 को.
जी 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 सर.
20 को है.
Okay.
Thank you. Thank you. Thank you,
Bye bye.
everybody. Bye-bye.
विवेक को एंड करनी पड़ेगी मीटिंग.
कर रहे हैं.
हाँ तो आएंगे तो आइए हाँ कितने अच्छा कौन कह रहे कौन कह रहे हाँ one question before we end. Is this only for the people who had registered? Expert से भी मतलब होगा. Hello. Sir, Shamik sir, should I end? Dr. Shamik. Hello.